think one of the really important pieces that we've been hearing a bit today through people's lived experiences is that the diabetes story doesn't exist alone, and that a lot of people are living with strong stories of intergenerational trauma. So to ignore that is to be doing people an injustice and to not be providing the appropriate supports that people require. So for example, we know that our social and emotional wellbeing is so strongly linked to our health outcomes, and we know that diabetes is related to things like stress and poor sleep. All of those impacts definitely impact diabetes outcomes, as I said, and so it's really important for us to acknowledge that the impacts of colonisation are definitely still being felt by people, and they underpin the structures that we work and live in today, and we need to acknowledge that there are lots of power dynamics within those structures, and so it is within our capacities, I think, as health professionals and policymakers, to acknowledge that those power dynamics exist and that we can work really sensitively and be reflective in our practice to ensure that people feel safe and supported when they're carrying these stories, and that there are opportunities to provide appropriate supports to help people to move past those and to live healthy, strong lives. I don't think I need to say anything else. I don't know that there are really any words to summarise this. I feel like the video sort of speaks to it enough. But of course, colonisation, which is the underpinning cause of a lot of this intergenerational trauma for our Aboriginal and Torres Strait Islander people, has left us with a bit of a legacy or racism. Racism is still very real, unfortunately, and a lot of people have the best intentions, but still sometimes some of our approaches may be racist, and many of the structures that we work within and institutions that we work in are underpinned by different discriminatory frameworks or approaches which obviously impact negatively on people. And so this is a really hard conversation to have, and it makes people feel very uncomfortable, but it's one that's really important because we all have a really important role to play here, and it can be little changes that we make in the ways that we engage with people, think about people. It can be as little as the language you use or the approaches in the space that create to make people feel comfortable and welcome. So I think that it's really important to acknowledge that, and we do have a lot of work to do in terms of overcoming the negative effects of racism and actually just conquering racism, full stop. This is a quote from a health professional who we recently engaged with in our youth type 2 diabetes work, and they said it's very emotionally challenging because you're constantly experiencing people that are not having the equal access to things that they are entitled to. So as I said, there are different levels of racism. It doesn't necessarily, it looks different at the different structural levels that we're looking at it from. And I guess I should also just add that Mary Wicks is doing some really important work through her PhD, which is highlighting different elements of racism. So, for example, microaggression. I think that we'll have some really fantastic, important learnings that will come out of that in the next year or so. So we look forward to that, Mary. Thanks, Ruth. That was a tough one.
And I think it's important to acknowledge that it's a difficult conversation, but the discomfort that we have in having the conversation pales in significance to the generations of hurt that people have felt. So, if we're going to change anything, we need to have these conversations so that we can move forward. So that's why we wanted to talk about them today. Again, the first question for this round is going to be reflecting on the stories that we've heard today, and I want to acknowledge the strength and courage and vulnerability of all the people who shared their stories today, because it's those powerful messages that are allowing us to have the conversations. And so because of the vulnerability that they've showed, then to pay respect to that, we want to make these conversations and discussions and the outcomes that we're going to get from this as powerful as possible. So we've heard today about people growing up around sickness and the sadness that their life, that their childhood had as a result of that. Of people being told that they were either going to lose their leg or lose their life. Of people losing 5 to 6 family members in a short period of time. Of lack of employment, housing and education. Of poverty, and then how hard it is to buy good food that's expensive. And how it's hard to change your life when every day is about surviving. So there are some of the messages that I heard this morning. So in your groups, you don't need to write anything down for this question, but just start the conversation safely around your table about the way intergenerational trauma and racism has affected the lives of people with diabetes, in your sphere of influence, in the people that you're living and working with every day.